So once you've decided you want to actually do a dental implant, we've gotten over that hump, people want to know, how long is this going to take? When am I going to get my tooth back? I think in general, assuming that we would have a relatively straightforward situation, we can answer that question by saying, okay, are we having to remove a tooth or are we starting with a missing tooth? When we have to remove a tooth, often today, we're able to immediately place the implant. If we look at implant healing in general, we know that it's about a 3 or 4 month process for that implant to have enough time to fully bond or integrate into the bone where we could put a permanent prosthesis on, which then leads to the next question. What do I do for a tooth in the meantime? I can't go out in public without a tooth. How am I supposed to eat? Well, we're going to provide some type of interim or temporary tooth or prosthesis, and we have multiple options to choose from. We keep examples in our office so you can see which one might work best for you. And so we're not going to have you leave the office with nothing in there, and we're going to always detail out what's your next step going to be. Start to finish, an excellent time frame from placement of implant to being finished is probably in the neighborhood of about 5 months. When we get past those hurdles, then we're looking at, well, hey, is this going to hurt? That's what people want to know. Can I resume my normal activities? Can I go back to work? Hey, I have a game that I'm going to go see. Am I going to be good enough to go to that game? Again, if you take a single tooth situation, I ask every patient on their post-operative visit, hey, how did you do? And again, after 30 years of doing this, you can certainly see a trend. I'm going to tell you that with single implants, maybe 2 implants, the average person's going to go home, they're going to have a little discomfort that night, they're going to be sore, they're going to know they had something done, for which we might give them a mild analgesic prescription that they can fill. When they come back for their post-operative visit and I say, hey, how'd you do? We find that a lot of people never even filled the prescription. They may have taken some over-the-counter pain reliever, and that for a day they were a little sore. By the second day, they felt like there was no problem. They almost resumed normal eating, and they just went about their daily business. This is what patients tell us. This is not extrapolation from our own mind. Every single person comes back for a post-operative visit, and my first question is, how are you doing and how did you do? And so this is straight from our patients.